Hello and welcome to Starburst Part 2 presentation for NLM 200 Current Issues in Healthcare and the Role of Nursing Leaders.
And these are the Starburst team members. I'm Kimberly May Avendaño discussing about leadership style.
I'm Jinal Chaudhary. I will present about nurse leader qualities in an outbreak.
I am Sumanjit Kaur, presenting a role of nurse in turbulence of outbreak of measles.
I am Lindsay Lanuza and I am to discuss nurse leader strategies to utilize and address outbreak.
I am Shashikala Sanjeev, presenting the strategies of nursing leaders during an outbreak.
Outbreak, the role of a nurse leader.
Presentation as follows: leadership styles, leadership qualities, strategies to utilize, outbreak, a turbulence, business tactics and skills, and a change theory scenario.
First, let's define outbreak. According to the World Health Organization, it is the occurrence of disease in excess of what is normally expected in the defined place or season. It may occur in a restricted geographical area or may extend over several countries, with duration that varies to days, to weeks, or years. An outbreak also defines any communicable disease long gone from a population, such as measles, or the emergence of a previously unknown disease, examples of which are SARS and Ebola virus.
According to Sehwag and Cubb, during an outbreak, nurses play a key role in all stages of the outbreak, including surveillance, case finding, and analysis of the data. These nursing leaders partner with all the nurses in the organization and with public health departments to address both hospitals acquired and community acquired infections.
What leadership style to utilize during an outbreak? Desperate times calls desperate measures. An example of when bad is good. Disease outbreak calls for autocratic leadership. The leader gives direction, the others follow direction. In an outbreak, decisions are made by hospital medical advisory committees, and these includes nurses. This will be executed accordingly. There will be strict policies and procedures to follow, as lives will be at stake should there be a break in a policy. For example, wearing PPE during the Ebola scare, or even wearing PPE during the measles outbreak just very recently. According to Center for Disease Control and Prevention, or CDC, nurses providing care to patients with Ebola must be supervised by an on-site manager at all times, and a trained observer must supervise each step of every PPE donning or doffing procedure to ensure established PPE protocols are completed correctly. This is according to CDC 2018. No nurse will have the time to complain with lack of democracy or complain about the donning or doffing with a powered air purifying respirator because they know how highly communicable and lethal the virus is, and this step must be followed. Disease outbreak can be exhausting for staff nurses. It can cause issues like low staffing levels in the nursing workforce, heavy workloads, high and low of emotions, stress, and an over-reliance on part-time, casual, and agency staff. This is a lot to take in for some nursing staffs and may leave some of them burn out or permanently leave the profession. A situation like this, the nurse manager must shift to transformational leadership to express support, inspire, and motivate.
Communication is very crucial as it proved. According to RNO, communication proved challenging. The government of the day and individual facility across the province scrambled to understand and relay accurate information. In the outbreaking of measles, nurse leaders participate in routine conference call with Ministry of Health, which also launched 24 by 7 telephone hotline questions and concern. Even if nurse communicate with the higher authorities and the public, which is essential to raise awareness of the risk of measles. So the next one is the response. Response means feedback or how you have to respond in any particular situations. So according to CNO, nurse as a leader need to advocate for organizational pandemic plan that reflect the care requirements and best interests of their clients. For instance, I have one scenario like little bit give more sense about the response. Like nurse leader came and the other nurse in the unit before familiar with all the detail of the outbreaking of measles, so they can develop a strategy to educate family and the client about the changes in hospital visiting policies. In collaboration with the healthcare team, the client's families, Kim can develop a plan for care for clients that will meet the professional standard during the outbreaking. This standard is applied by demonstrating respect for empathy with the interest in the client and by developing collaboration partnership with the clients and families that respect the clients and families' need, knowledge, experience, values. Let's move further. So the next one is critical thinking. Critical thinking plays very vital role in the outbreaking of measles or anywhere because you have to put your knowledge into action on a right time. So as per College of Nurses Ontario, nurse leader guide unpolished practitioner like the other practitioner whoever work with them or in the use of critical thinking to develop their abilities to make decisions based on complex array of factors. The skill is vital in healthcare environment with increasing instance of multidisciplinary collaboration. For an example, vaccination to susceptible person, administration of post-exposure prophylaxis like the vaccine or immunoglobulin, social distancing techniques like isolation, quarantine, exclusion. In elimination setting, a single measles case is public health priority and prompt identification and investigations of measles is important to help expedite outbreak control strategy. Interpersonal relation or interpersonal skills. Nurse as a leader, like nurse leader are the links between higher authorities and patients. So interpersonal skills are very important for nurse leader. A great leader has excellent interpersonal skill and work well in the variety of situations with different people. During the outbreaking, an analysis of outbreak notification and response data should be done at the end of under-immunized people that may require targeted preventive.
Nurse leader strategies during outbreak. According to the article Emerging Global Issues, a nurse role further supports this as stated. Nurse leaders have valuable expertise, competencies, and grassroots perspective to impact the prevention, spread, and management of infectious diseases outbreak. They are positioned for important roles in care delivery, education, leadership, and policy making to influence population health outcomes. And these are some of the effective strategies that nurse leader can apply during an outbreak. So first will be knowledge. It is the nurse leader responsibility to make sure that nurses and other healthcare provider on the ground are fully aware and understand the signs, symptoms, and progression of diseases, and when to indicate potential outbreak. Their ability to do health quickly and diagnose certain disease potential outbreak saves lives and reduces a potential spread or highly communicable diseases. The second will be readiness. When an outbreak occurs, it is the responsibility of nurse leader to scientifically respond, control, and identify the disease outbreaks and how to properly manage it. Some of the hospital guidelines are like poster on how to wear PPE, hand washing, hospital directives memo regarding, for example, like measles or SARS. Um, Also, providing healthcare education to other healthcare teams such as cooks, food service staff, caregiver, and child worker are also well informed on the best practice for prevention of outbreak or diseases. The third and last will be the collaboration and resources. An article from Barbara points out that nurse leaders are critical and analytic thinker who possesses higher level problem solving and strategic planning skills. Specific prevention responsibilities of nurse leader include surveillance activities that identify risk factors and monitor incidents and infection diseases. This involves effective interdisciplinary collaboration with medical providers, microbiologists, pharmacies, pharmacists, and statisticians to facilitate the development of risk estimates and predictive models for outbreak. Thank you.
Other than strategies, there are comprehensive outlines that require an interprofessional response and a clear chain of command that a nurse leader can use as a guide when outbreaks occur. First one, identifying signs and symptoms. Nurse leaders' responsibility is to identify the nature of the crisis, activate a plan, implement actions so that many lives can be saved and minimize the spread of disease. Also, consultation of public health unit is important. An organization's internal and external communication strategy should be clearly delineated in the organizational readiness. Once the outbreak management team has been activated with outlined outbreak control measures through written plans, policies, procedures, job responsibilities, and guidelines related to dealing with various types of crises which can be experienced by the organization. These measures can be implemented as soon as the outbreak is suspected with sufficient supplies of personal protective equipments. Also, the collection of specimen plays an important role as every nurse should ensure that staff collects appropriate specimen in a timely manner to verify diagnosis, allowing special situation to get proper considerations which may include changes in the severity, new cases in the prophylaxed population, suspicion of a non-viral agent, and so on. Next, when we look at admission and readmission, along with prevention and treatment, I would like to give you an example. When experiencing an outbreak, long term care homes with support from the public health units need to be vigilant regarding admission and readmission of the residents to ensure that due to diligence that has been exercised in order to protect them and also with whom they may come into contact. The most important thing, health education, where nurse leader along with other leaders in the organization should practice disaster deployment activities yearly and continually with care competences, which prepares staff to safely deploy in support of disaster operations. Although it is important to train a personnel through drills with simulations and discussions, every nurse leader must also should practice communicating with healthcare staff, patients and families. Last but not the least, which is every nurse leader should keep following up with all the cases with proper health teachings, immunizations, home visits and so on.
The rise of an outbreak is turbulence in healthcare that must be addressed by nurse leaders, including knowing priorities, using appropriate and credible online sources to verify facts, statistics, and data, and utilizing business tactics, and skills now more than ever. Nurse managers may or may not require clinical expertise to fulfill their duties. Instead, they require practical business skills, tools, and tactics for comprehensively managing departments and ensuring personal career success. Based on need and the span of control, nurse managers may find themselves having to respond promptly by making staff adjustments, respond with new training, new equipment, decommissioning outdated treatments, and change budget priorities. Thoughtful consideration must be done in order to implement the policies for outbreak. Questions like, do we need to purchase more vaccines? Do we have enough supply of masks, gloves, soap, or sanitizer? Will it help to create a flyer to help everyone know about the disease outbreak or use the social media instead? If the surge in measles outbreak are from children coming from travel overseas and it's validated from the reports, will it help if information disseminated in the airport regarding prevention and knowledge dissemination? Who do I relay this thought? Make newsletters and memos to avoid assumptions or unnecessary questions being raised due to ambiguity regarding, for example, measles. Another example is creating a memo stating only one guardian allowed for visiting hours must comply to hospital policy regarding use PPE. Here is one recorded example of business skill. Nurse leaders can create Facebook page or run a website that has evidence-based practice support regarding the outbreak and provide helpful links that link the public access for more information or help. Other ways to convey messages are email, presentation, writing for a journal article.
Last part is a case scenario featuring Lowen's change theory model.
In the pediatric unit, Seneca Hospital, nurse manager discussed a new policy regarding visitors.
Good morning.
Good
Good morning. I called you for a meeting because there is an outbreak arising, and the hospital came up with a strategic plan to implement during this time. So our new plan is restricting visitor during outbreak.
Oh, does that mean that we don't get help with feeding? We have a lot of patients here and we can't feed everyone all by ourselves. We need help from them.
And also, I think for psychological support, family is the most important for kids, especially because we are always strangers and they don't feel comfortable with us.
Yes, I understand your concern. The nature of the disease is highly communicable. And I was instructed by the hospital to implement a preventive measure. I know we are all doing very well in reducing the spread of a possible disease and we are ready to manage an outbreak. However, a report from another hospital that most of the newly admitted cases are relatives of the infected patients.
Oh, I see.
Yes, so for your concern, there will be unregulated care provider to help during mealtime, and immediate family members can still visit, but one person at a time.
Oh, that sounds fair.
So all of us agreed with the new plan?
Yes, I think so. Yeah.
Thank you.
In this scenario, the nurse manager explained to the nurses the reason behind the new hospital policy regarding limiting visitors is unfreezing. Cognitive restructuring, or the change itself, is a new policy implemented. Refreezing are all the quality checks done to make sure that this new policy works and is effective.
To end, we have discussed the need for autocratic and transformational leadership in an outbreak, communication, use of critical thinking, promptness to act, and people skills are the necessary skills the nurse leader must possess in this situation. Investing in knowledge, readiness, and collaboration are the strategies that are effective. We have included a comprehensive outline of action used by nurse leaders. Finally, we have discussed turbulence and business tactics that may be utilized in an outbreak.